clinical practice, yeah. So I am a clinical psychologist. That's my main job. And I was originally trained in the psychodynamic model, where the relationship between the therapist and the client is the way healing occurs, to have a compassionate and understanding relationship. So that's the way I was trained. And then after that, I learned to integrate mindfulness into psychotherapy. And my experience of mindfulness was that it was more focused on exercises that people can do, and also a little more on moment-to-moment experience rather than the relationship. You know? So then I got interested. How can we bring the healing relationship into mindfulness? And that's compassion. That's compassion. So compassion is very personal. It's about you and me, and it's a warm or loving or kind response to suffering, which is what we experience, what we work with all the time in psychotherapy. But what is marvelous about mindfulness in psychotherapy is that people can practice mindfulness between sessions. So you have not only 1 hour a week of practicing mindfulness in the relationship, but you also might have maybe 15 hours. So this is a benefit. So what I thought was that compassion can be portable therapy. Portable therapy. So you can actually take the relationship, which we have in psychotherapy when we physically meet, in other words, the kindness and the understanding, and we can practice relating to ourselves also when we're alone. So I thought, this would be a important new development in psychotherapy.
MSc.
How was it developed?
What were its origins? This short history.
Yeah, so I became interested in self-compassion in 2005. And there was a researcher in the United States named Kristen Neff who created a scale to measure how self-compassionate we are in 2003. So when I started becoming interested in this, I gave Kristen Neff a call. And I said, we should meet and have a conversation. So she has been doing research using her scale. And this, using a scale, you do what's called correlational research. So you see, if somebody is self-compassionate, maybe they also have emotional resilience, maybe they also have good relationships. So this kind of research was happening. So I said to Kristen, what you should do is create a program where you actually train people to be self-compassionate, and then we can see what the impact is of training. In other words, not people who are just self-compassionate already, but let's take people who are not self-compassionate, help them to become more self-compassionate, and see what happens. So she said to me, well, I'm a researcher, I don't do that sort of thing, but you're a clinical psychologist, Chris, that's your world. So then we looked at each other and thought, let's do this together. Yeah, so then the program we first did the program in 2010. And then in 2014, we started teacher training, and now it's 2016. There are like 600 or 700 teachers around the world. So the interest around the world, all over the place. We're doing teacher training in China, Korea, 4 or 5 countries in Europe, United States. It's amazing. And each country has the same intense interest everywhere we go. So this is something which is, we found this is universally appreciated, not just, in Spain or America or Germany.
We are lucky to enjoy it. now. Yeah.
Thank you. So mindfulness and acceptance is in some ways, a radical new approach to psychotherapy, where we're not trying to change actually how a person feels, but we like to change how they relate to the feeling. So if somebody's feeling sad, we're not trying to cheer them up. What we're trying to do is to make some space or room for the feeling, you know? It's like if you have a bowl and it's in a very small space, it'll be loud. But if you put it in a big field, the bowl relaxes, you know? Same thing with our emotions. So mindfulness and acceptance-based therapy is about making a lot of space, you know? However, sometimes people have emotions which are so difficult to feel that it's very hard to accept, very hard to make space, because the sense of self, the person who's observing, who's trying to be accepting, is overwhelmed. So what happens naturally in psychotherapy when somebody's overwhelmed is we comfort and soothe the person. And when the person feels safe, then they can be mindful. They can make a big space or accept the emotion. How do you comfort and soothe a person? How do you help a person to feel safe? So it can happen in a therapy relationship, but it also can happen at home. So self-compassion training is the capacity to comfort and soothe ourselves as a foundation then for working with very difficult emotions. So sometimes when emotions are intense and disturbing, first we have to hold the self, and then after we can hold the experience or hold the emotion. Don't think we can do that yet. I think we can consider mindfulness, acceptance, and compassion third generation. So mindfulness and acceptance hold experience in a new way, and compassion holds the experiencer in a new way. Both have in common a new relationship. One is a relationship to the emotion, one is a relationship to the self. So I think they're really more similar in that way. I would love to know what the fourth generation would be, but I think we have to wait and see. Maybe it will be compassion.
We need passions.
Yeah. Maybe it will be compassion, but in my view, it's very close to the mindfulness and acceptance-based therapy. So I say, when somebody says, what kind of therapist are you? I say I'm a mindfulness, acceptance, and compassion-based therapist. It's just the beginning. The first book on self-compassion was published last year, Self-Compassion in Psychotherapy, a book by Tim Desmond. There's a lot of research which shows that this mechanism, this trans-diagnostic mechanism, is associated with so many different forms of psychological well-being, you know, so decreased anxiety, decreased depression, increased emotional resilience, decreased stress, increased happiness, improved relationships, healthier behaviors, greater health, you know. So we know that it is an important trans-diagnostic factor. But it's only now being applied in psychotherapy. It's only now being applied, and in healthcare, we can say that it's very, very much in the beginning. And so I can give you an example. some colleagues and I at Harvard University created a Center for Mindfulness and Compassion. And we are teaching mindfulness, and we will also teach compassion and self-compassion. And also at Harvard, there's a compassion center. It's called the Schwartz Compassion Center. And their wish is to teach physicians how to be more compassionate. So the question is, in the healthcare field, how will compassion be utilized? In particular, compassion training. This is the most important thing. Compassion training. How will it be utilized? And will mostly be utilized at first as a way to help doctors and medical staff not to burn out, not to feel so much stress in connection with suffering that they can't function. So this is the physical health side, the hospital side. In the psychotherapy side, I think we're a little further along, you know. But also in the psychotherapy side, it's very important to be self-compassionate so we also do not burn out. But in the psychotherapy side, we are already integrating techniques, compassion training techniques into psychotherapy, and also we're teaching therapists how to maintain a compassionate attitude even, you know, when they are afraid or when they're angry or when they're distracted. So there are many different applications, and we are just in the beginning stages. Yeah, so the first step will be caring for the caregiver, you know, for the doctors, for the therapists. And when they experience the beneficial effects of compassion for themselves, then they will begin to want to teach this to their patients, because they will find that they become healthier and happier, and then they will start to think, how can I help my patients suffering from cancer? And this is already happening, you know. We've taught 600 teachers, and they are working in cancer units, you know, they are working with people who have trauma, they're working with severely psychotic people. They're already thinking, how can I bring this to my patients? But usually they first have to experience it themselves, or else they'll be kind of skeptical. It's like, I don't know about compassion. Most people think they have too much compassion. They think they have too much compassion. But actually what they have is too much empathy. And so that's a whole other subject, but there's a lot of misunderstanding exactly what compassion is. So you've asked, is practicing mindfulness and acceptance-based treatment in psychotherapy premature, and then also is compassion premature? So first of all, we have to start somewhere, and the way we actually learn whether something is effective is some people have the courage to go ahead and try it, you know. In the mindfulness and psychotherapy world, there are now in the academic literature, peer-reviewed academic literature, you know, over 4,000 studies. And just last week, there was a meta-analysis of mindfulness-based cognitive therapy for depression, and they found that it's very effective, as effective as medication, and is even most effective with people who have severe depression. So this is really important, you know. So we're now looking at the, you know, lots of studies to see what do they all show, you know. So mindfulness now is really becoming more and more accepted, not just by psychotherapists, but by scientists. Compassion, as I said, is pretty new, you know. A lot of scientists are looking at particularly self-compassion for the same reason that I was interested, because it focuses more specifically on emotion and on how a person is feeling and how they can comfort and soothe themselves, which is a lot of what we do anyway in psychotherapy. So some people say compassion-based psychotherapy is mindfulness for psychotherapists. But this is a new thing. We don't have a lot of good studies on this. Christine Brailer, I believe, did the only randomized controlled trial on compassion-based therapy. There's a lot that needs to be done, and it is now being done. Particularly now because we have a training program, the Mindful Self-Compassion Training Program, which teaches people self-compassion. So now, now that this program is pretty solid, people will begin to apply it to clinical populations. So how about self-compassion for trauma? How about self-compassion for depression? Even the researchers the main researchers for mindfulness-based cognitive therapy, they're interested, I wonder what would happen if we added self-compassion to mindfulness-based cognitive therapy. So this is the way we are thinking. So we say that compassion is coming into the clinical world on the heels of mindfulness. But we have a long way to go. It's very new. Here in Madrid, we are right at the edge, the growth edge.
The future.
Yeah. Some people actually even say that compassion-based therapy is the future, the next 20, 30 years of psychotherapy. Some people say this because it is so similar to what we do anyway. It is like portable therapy. But what people don't understand about compassion is they often think, as I said, it's weak. But what we have now is what we call secular compassion training. So we've been learning compassion for thousands of years in the context of religion. But this is now scientifically based secular training. And so we're learning three things. One is that compassion is a strength. It's not possible to have too much compassion, particularly fierce compassion, knowing what to do. And what we say is it's not compassion if it doesn't actually help. So compassion is a strength. The second thing is it can be trained. People don't know that it can be trained. And even self-compassion can be trained. And the third thing that most people have not known until this time is that you can give compassion to yourself. Usually, we think, compassion means compassion for somebody else, and, no, not me. But with self-compassion, we're saying, no. Compassion for everybody, including yourself. So it's a very humble project. It's not me. It's like everybody, including me. So we can also give it to ourselves. So as we develop the science of compassion, we learn that it's a strength, it can be trained, and it can be also directed at ourselves when we suffer, when we fail, and when we feel inadequate. So that's a very good question, because compassion is a very powerful medicine. So what we say is when we give, particularly self-compassion, when we give ourselves unconditional love, we discover the conditions under which we were not loved. So if you treat yourself very well, or if somebody treats you very well, you start to remember when you were not treated so well. So that's what we call backdraft. It opens old wounds. So this is a natural part of the healing process. But we need to expect it. We need to open to it. Let's say we give kindness. We discover when we were not treated kindly. And then we treat ourselves kindly now, better than we were treated back then. So that basically is a reparenting process. We can actually be better parents to ourselves than sometimes our parents were able to be to us. So your question was, are there some people perhaps who this is not such a good thing for, And so I believe that compassion is always a good thing, but the main question is, how it's delivered. You know? As I said before, what good is compassion if it doesn't actually help? So we need to know that when we give ourselves kindness, sometimes we feel good, sometimes we feel bad, and sometimes we feel nothing, right? And many different reactions can occur. But we do not want people to become overwhelmed by trying hard to give compassion, you know, compassion, compassion, compassion. You can give too much compassion, and then there's too much backdraft, too much difficult old feelings come up. So that often happens when people have a lot of trauma, and they have not worked with it before. Sometimes it happens with depression and so forth. So what we say is that the most important starting point for giving compassion is creating safety. So we ask our people, what do you need? What do you really need? And we say, especially, what do you need to feel safe? This is the foundation. Because safeness is the physiology of compassion. So first is, what do you need to feel safe? That's the first part of compassion. And then the second part is warming up awareness. Warming it up. In other words, we're not just looking like a scientist. We're also warming it up. We're holding it like a loving parent might hold it. So those are two parts of compassion. So first safety, then warming it up. But sometimes the warming it up is hard. So then what we say is behavioral self-compassion. How do you care for yourself already? Do you listen to music? Do you walk your dog? Do you meet with friends? Do you take a nap? Do you exercise? How do you care for yourself already? And then we say, when you feel bad, do that. So that's when self-care becomes self-compassion. Because we are responding with kindness and understanding to suffering. But we're doing it in this case behaviorally and in a very, very ordinary way. So the question was, are there any cases in which we do not want to give compassion? Yes, sure, maybe trauma and such things. However, even when we're traumatized, behavioral self-compassion, starting with safety, is effective.
So, thank you very much again, Chirstopher. It has been a magnificent and great experience being here with you, with the other teachers, and the experience of Christine's brother, Beth Mulligan, Mark also, everybody's Constanza Calatayud. It's been a great experience, and I will hope to see you soon.
Well, thank you, and I would just like to say, first of all, thank you for this interview. Thank you for coming to the program. And what was really very special and very unique for me in this teacher training was the inclusion of everybody. In other words, the feeling everybody is included, everyone belongs. So that sense of common humanity and feeling compassion, the idea of compassion is just like me. Just like me. And everybody was so kind to each other. So this is the perfect ground for learning self-compassion. So I was thinking, wow, if we could do teacher trainings in other countries like they do it in Spain, the future of self-compassion is very bright. We're so happy and so grateful to have had this opportunity to do this together. Thank you.
So you have been so generous for us. Thank you very much.
Thank you.